Good afternoon, esteemed faculty, honored guests, proud families, and most importantly, the exceptional nursing graduates of North Idaho College. Thank you for joining us as we welcome the May 2024 class, move from student nurse to graduate nurse. My name is Arlene Pickett, and I'm the Associate Dean of Health Professions and Nursing here at North Idaho College. Before we begin, I would like to extend a thank you to our Board of Trustees and our college administration. If you are here, please stand. I would ask that the audience hold your applause until the end. From our Board of Trustees, Todd Banducci, Greg McKenzie, Mike Wagner, Terry Zimmerman, Brad Corkle. From our college administration, Dr. Nick Swain, President of North Idaho College, Dr. Lloyd Duman, Interim Provost, Tom Green, Interim Chief Communications and Government Relations Officer, Sarah Garcia, Vice President, Controller, Finance and Business Operations, Ken Wardinsky, Chief Technology Officer, Rael Anderson, Director of Development and Foundation Executive Director, Dr. Sherry Simpkins, Dean of Instruction, General Education, Tammy Haft, Dean of Enrollment Services, and Alex Harris, Dean of Student Services, and Vicki Isaacson, Dean of Instruction Workforce Development. Please join me in thanking them for their support of the Associate Degree Nursing Program. And my apologies if I've forgotten anyone. In addition to our amazing full-time nursing faculty, who I will introduce shortly, I would also like to introduce those individuals who are instrumental to the success and support of our students. If you are here, please stand. And again, I would ask the audience to hold your applause until the end. Leslie Slinkard, Assistant to the Dean. Amy Howland, Senior Administrative Assistant for Nursing. Stephanie Bradbury, Clinical Placement Coordinator. Wendy McIntosh, Nursing Student Success Navigator. Betsy Connery, Health Professions Student Success Navigator. Jeff Davis, Pre-Nursing Advisor. Miles Larson, Simulation Operations Specialist. And Jennifer Harden, Lab Coordinator Assistant. Please join me in thanking them. We also have many faculty who supported students in the prerequisite general studies courses. Please stand if you're in the audience, and let us recognize you with our applause. And our many adjunct faculty, clinical instructors, and preceptors who both faculty and students depend on. If any of you are in the audience, would you please stand so you can be recognized? Blythe Howard and Jennifer Casas, please come to the podium to lead us in the Pledge of Allegiance.
Would everyone please stand?
Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You may now be seated.
As they return to their seats, I want to recognize our students who are military veterans and thank them for their service. If there are any graduates who are veterans, would you please stand at this time so we can recognize you? At this time, I'd like to invite Dr. Nick Swain, President, to the podium to share a few remarks.
It's always amazing how bright it is when you get up here. I just want to have you graduates stop and think for a minute about where you are and how hard you've worked to get here. This is pretty impressive. I think you have a lot to pat yourself on the back for all the hard work and effort that you put into getting here. So just take a moment and take it all in, because it's pretty cool. This is a great nursing program. So I'm going to start by going off script and just say, you may not realize this. Some folks come here for this reason, even from far away, because almost 100% of our students graduate and almost 100% pass the NCLEX exam, which you all know, but many people in the audience don't know. It's the same exact exam that students that go to a four-year college for nursing have to pass. And these guys did it in 2. So the nursing program that you're graduating from is ranked first in the state. Did you all know that? Yeah. We're not proud of that or anything. But even better, this little college in North Idaho on the north shore of the Coeur d'Alene Lake is ranked 61st in the nation. Did you know that? That's pretty cool. 1,700 plus programs, and you all graduated from the one that's ranked 61st. So what I think that means is that it's a tough program. Anybody disagree? Graduates? I can't really see your faces, but I don't see anybody saying, yeah, it was an easy program, man, no big deal, right? You worked hard. The faculty, the staff, all those folks with student success in their names have a lot to do with you getting here. But you all put a lot of work in, and I know they were not easy on you. And as a result of that, you guys are graduating from the top program in the country, or in the state. And that means that you'll never have a problem finding a job, because everybody wants our nurses, and that's another great thing. So just revel in where you are and all that success, because you've earned it. So I want to warmly welcome you all today and to this important milestone in the lives of the students that are going to go through this pinning ceremony. It's a day of immense pride, honor, and accomplishments as we acknowledge our graduates and the class's relentless hard work, dedication, and resilience. We're gathered here today to present a pin and a celebration to celebrate a journey that began with a deep-rooted passion to serve humanity, that has been nurtured with knowledge, seasoned with patience, and tested in real-world situations and some really cool simulations. As a family and friends, we also acknowledge your role in getting them to this point. So, graduates, if you turn around and say thanks to your family and friends that helped you get here and covered all those things that you had to bail on at the last minute because you had homework or some report you had to get out, or your patient charts that you had to update. They were there for you, and as a result, you're here now. So thanks to all the family members. The pinning ceremony signifies the end of one journey and the beginning of another. As graduates don their pins, they step into a world that will constantly challenge and push them. But they have chosen this same world, driven by the desire to make a difference. The pin is much more than just a piece of metal. It symbolizes perseverance, commitment, dedication to a profession that demands the best from its practitioners. It's a token of respect for the countless hours spent studying, training, and practicing to ensure the health and well-being of your patients. As we celebrate our graduates, remember that every nurse's journey is unique, but they all share a common thread, a dedication to the service of others. It is this dedication that we recognize and honor today. So without further ado, let's embark on this cherished tradition that pays homage to the history of nursing and the future, where our graduates will shine brightly. touch lives, and continue to uphold the noble traditions of nursing. Thank you all for being here and joining us on this special occasion. And all those little guys in the audience are probably like kids of the graduates. Great to hear you're here too. So today we're pinning our nurses and our hopes for a healthier and more compassionate world on them. And let's commence with the ceremony. Thank you.
Thank you, Dr. Swain. We appreciate your ongoing support of the nursing program. Today, we gather not only to witness the results of your years of hard work and dedication, but also to celebrate the beginning of your journey, a journey into the heart of healthcare where compassion, skill, and empathy converge to make a profound difference in the lives of others. You chose to attend the NIC nursing program, hopefully, because of the reputation we have for great outcomes. The expectations of you have been high. Let us take a moment to reflect on the incredible journey that has brought each and every one of you to this pivotal point. The path to becoming a nurse is demanding, filled with challenges that test your knowledge, your resilience, and your character. Yet here you are, ready to take on the responsibilities and privileges that come with the title of a nurse. As many of you know, I've been a nurse for a long time. 44 years ago, I was pinned on about this same day. I've been involved in nursing education for around 20 years, so almost half of my career. I have to say, I don't know that my journey through nursing school was much different than yours. I panicked over exams. I literally sometimes slept on my textbooks, hoping that the knowledge would seep into my brain through osmosis. If you tried it, you know that doesn't work. I went to my labs and clinicals each week convinced this was the day I was going to be dismissed from the nursing program and my career would be over before it got started. I had to do things that I didn't think any human should be asked to do. I asked questions of my patients that I didn't think I had any right to ask. I put my fingers in places I didn't think I would ever have to put them. And yes, I too complained about the endless care plans, better known to you as focused case studies. I spent hours on those things. I too would later admit I gained a lot of knowledge, though, from having to do those. I graduated and I took my board exams. Hate to date myself, and it's kind of like the story where you had to walk uphill in the snow to get to school both ways. We didn't have any computers. I graduated and took my board exams. In those days, the exam was offered only 2 times per year. We had to travel to Boise for 2 days to complete it. There were 5 separate tests. You had to pass all 5 exams, and if you didn't, then you had to wait for another 6 months to repeat the exams that you didn't pass. And then we had to wait for 6 weeks for the envelope to come in the mail to say if we passed or not. If you got a thick envelope, that was a bad sign. If you got a thin envelope, it was good. Probably it had your license in it and you were good to go. Luckily, I got the skinny envelope. It was touch and go. OB and psych were not my game. I entered practice during a severe nursing shortage. There were vented patients on the floor. Hall beds were a real thing. And I was oriented by one of my fellow graduates who had happened to take a position at the hospital right after graduation. Over the course of my career, I've learned from my patients, my coworkers, and my students. There have been times where I admittedly have hung on by my fingertips. I can recall a shift which was probably the worst shift of my career when I was a house supervisor of a small acute care hospital. We had 5 codes in one night. It was a smaller facility where it was popping if we had 50 to 70 patients. So 5 codes was about 10% of our census. Some of the patients survived and some did not. There was 1 or 2 of the codes where the ER doctor was tied up, taking care of other serious situations elsewhere in the facility. So the nurses were left to run the code, armed with ACLS protocols and our knowledge obtained over the years of practice. Remember, nurses were there to run the codes. I remember the chaplain coming in the next morning towards the end of my shift. It was a night shift, and I'd had to call the chaplain many times that night so that she could talk and support the families. When she saw me, she asked how I was. I said, honestly, I can't talk about it right now. And please don't touch me, because if you hug me, I will shatter into a pile of tears, and I still have work to finish. The staff were exhausted by the end of the shift, but we supported each other. We knew we had given the best care we could. We came back the next shift hoping it would be calmer than the previous night. We were resilient. For every story I have like that, I have tenfold the number of good stories. Stories of when I know I made a difference in the lives of my patients and the staff I supervised. You will have good days and bad days. Learn from the bad days and cherish the good days. You've challenged faculty to stay current in knowledge and practice. I will be honest, there were days where I felt lucky if I was one step ahead of the students. As faculty, we admit we don't know everything, and frequently we have to look up stuff just like you do. The takeaway is it's okay to not know everything all the time, but know how to use your resources and to figure out the answers. And don't be afraid to admit you don't know the answer. Don't be afraid to ask questions. That is much safer than trying to figure out on your own or just winging it. From a personal perspective, when I've had a loved one in the hospital and the nurse is someone I had as a student, I feel an immediate sense of relief. I can tell you story after story of the times my family members have been cared for by somebody who is unfamiliar, who didn't demonstrate the critical thinking that I had come to expect from the students I had trained. The extra burden it placed on my family and me to be vigilant so we could keep our loved ones safe was immense. We've had to intercede to prevent medication errors, make sure the caregivers understand the current situation. If it was a previous student or nurse I'd interacted with during my time with students, I felt a sense of peace. Now, I don't know if my previous students felt that way when they saw me. I hope I didn't mess with their confidence or cause flashbacks to nursing school and the unintentional fear that they had when I walked by their side through their nursing school journey. I tried not to be the faculty member who instilled that fear, but I was confident my family member was going to get good care. They treated me as a family member, not an instructor or a nurse. They were prepared, though, when I asked them more probing questions than the Joe public would ask. And they went and looked for answers if they didn't know. They were compassionate and understood when we wouldn't leave my father alone because he was impulsive, and we knew he would try to get up unassisted. We didn't want him to fall and pull out tubes. I could always count on them to care for the whole patient in the family unit. They also were not afraid to tell me when I was out of my lane and gently guided me back to the role of a family member. Please be that kind of nurse who's compassionate and caring, even when your day is off the rails, busy and chaotic. You will never likely know how much impact you have on the lives of your patients and family. You will never know how you give the family the peace of mind to go home and rest because they know you have their backs. I will always continue to be grateful for my nursing career, and I only hope that you feel that same sense about your career. And know that we all recognize the sacrifices and fears you have experienced along your educational path. So today, as you join the ranks of registered nurses, you do still have that one little test standing before you, but I'm confident that you're going to do well. Tackle your career with the same gusto you've had throughout the program. However, While you did all of the studying, taking exams, writing the beloved papers, and completing the focused case studies, you likely could not have done it with the unwavering support of your family and friends who stood by you through this demanding journey. Their encouragement and understanding and sacrifice have played an integral role in your success. So let's take a moment to express our deepest gratitude to them. Graduates, will you please rise and turn to those who are here to help you celebrate this success and give them a round of applause. Other members of the campus community who have been part of your student journey are the faculty and staff across the NIC campus. They've been there to support, encourage, and at times push you to stretch your minds. Nursing faculty have taught you the importance of making sound clinical judgments based on evidence. You've been taught to assess every situation so you will select and provide the best interventions. I'm joined on stage by the nursing faculty who truly care about your success. After all, we want well-prepared nurses to take care of us and our loved ones in our time of need. I'd like to take a moment to introduce those who have been part of your students' journey over the last 2 years. Please hold your applause until the end. Faculty, as I call your name, please stand. Rachel Kalk, Stephen Smith, Tricia Robinson, who couldn't join us this evening, Sharon Funkhauser, Blythe Buchan, Connie Sue Klum, who, by the way, just completed her own milestone by earning her doctorate of nursing practice last week. Megan Netting, Barbara Richardson, Donnie Morrison, and Melissa Katine. Please join me in thanking them. You can be seated. You've balanced family, school, and jobs while you've endured nursing school. Some of you have experienced personal tragedies, but you kept going. Your stories, as I hear them, are truly extraordinary. Many of you also took the opportunity to concurrently enroll in LCSC or another college or university to work on your RN to BSN degree. Some of you will finish those additional requirements within the next 3 to 6 months and have your bachelor's degree. Your dedication has not gone unnoticed. As you embark on your nursing career, remember that your journey doesn't end here. It merely takes a new direction. Nursing is a profession that requires a lifelong commitment to learning, growing, and adapting to the ever-evolving landscape of healthcare. Embrace this journey with an open heart and a curious mind. We hope we have prepared you well for that. Brittany Heidenreich has been selected by the class to give the keynote address. Brittany graduated from Carroll College in 2009 with a bachelor's degree in nursing. She has worked in medical, surgical, and oncology units. She graduated from Gonzaga University in 2014 with a master's of science in nursing education. Brittany came to NIC in 2015 as an instructor in the PN program. She became the PN program coordinator in 2018, and then the program coordinator for both the PN and the associate degree programs in 2021. Please join me in welcoming her to the stage.
I gotta say, you guys, I'm a little nervous, but as soon as I saw you guys walking down and you just look so graceful, I was like, oh, thank you. Thank you for having me here. It really is a privilege. Thank you so much for inviting me back, for letting me speak here today. It means so much just to come back here to North Idaho College and see all of you. I am so excited for you guys. So today, I'm gonna tell you how to live a happy life, a long life, and a successful life. Like, pretty simple, right? But I'm gonna start by telling you a little bit about me. That introduction that Erlene just gave was great, and it did highlight some of my greatest accomplishments. I'm really proud of those accomplishments, but those accomplishments are not what I'm most proud of. I graduated nursing school at the young age of 21 years old. I came out of school with confidence and excitement. I was hired before I graduated. At first it was hard, the transition was rough, but I had a great support system at work. I had good coworkers, a reasonable manager, and eventually, after about 6 months, I kind of felt like I knew what I was doing. Eventually, I had doctors telling me how impressed they were with my skills as a new graduate, and over the next 3 years, I felt like I became a better and better nurse. Until one day, I had my first patient code. She was a fresh admission from the emergency department. She coded before I even got the admission done. I was scared, I was in shock, and I was anxious. Soon after that, I began blaming myself. I must have done something wrong, or I must not have done something fast enough. I began questioning every decision I made. My anxiety grew. Eventually, I was able to start to cope with my anxiety as the years went on. My fellow nurses, my friends, they made me realize that I didn't make a mistake. I didn't do anything wrong, and that sometimes things happen to patients despite our best efforts. And that I was a knowledgeable nurse. So I was able to cope with my anxiety, but it wasn't gone. There was still this lingering feeling of worry that something bad was going to happen. And several years later, it did. My nephew died unexpectedly. He died of a drug overdose at 17 years old. All at once, my fear, my anxiety, my self-blame came rushing back. What did I do wrong? How did I not notice that he had a problem? Did he have a problem? Or was it one mistake that went terribly wrong? The self-blame was unbearable. I threw myself into work, and I was working here. The amount of love and support that I got from my coworkers, my boss, and more importantly, my students was overwhelming. Work was one of the only places I felt like I was achieving something. Home was hard. Everyone in my family was suffering. I felt like I didn't have anyone to turn to help with my grief. Work gave me the relief I thought I needed to move forward. But from that day on, I was less social. I was less likely to share my feelings or let anyone get too close to me. I felt like if I kept my distance, it would hurt less if I lost somebody in the future. Again, I learned to cope. My life went on. I had some amazing, happy times, but my anxiety was still there. COVID hit several years later, and then I felt like I needed to socially isolate myself even more. We often talk about caring for the patient as a whole person, but sometimes we get caught up in the tasks of the day, treating whatever physical ailment our patient comes in with. We underestimate the mental, emotional, and spiritual side of being a human. So let's go back to what I promised you. How to live a happy life, how to live a long life, and how to live a successful life. Topic 1, happiness. I watched a couple of presentations that I want to share with you. The first by psychiatrist and psychoanalyst Robert Waldinger. He is the 4th director of a 75-year-old study, the Harvard Study on Adult Development. The study followed 2 groups of men throughout their lifespan. The 2 groups were vastly different from each other. One was a group of men enrolled at Harvard College, many of whom ended up going to war. The other group was a group of young boys that lived in Boston's poorest neighborhoods. They reach out to these men every 2 years with a series of questions for 75 years. They don't just send them questionnaires. They went to their homes to interview them. They interviewed their spouses. They accessed their medical records. And overwhelmingly, this is what they found. Good relationships keep us happier and healthier, period. Topic 2, living a long life. The second presentation I want to share with you was from a developmental psychologist, Susan Pinker. She starts by talking about how women live longer than men. And this is pretty much true globally, except in certain areas. One being the Italian island of Sardinia. The life expectancy of men and women are the same in those areas. The villagers were living into their 80s, 90s, and 100s. She began to ask herself why. What are they doing right? She went to the village. She noted that it was a dense, tightly woven community. She states, the villagers' lives constantly intersect. She noted that as the villagers aged, they always had a support system. Relatives would express that it was a pleasure to take care of their aging loved ones. In her presentation, Susan Pinker refers to a study done by Julianne Holt Lundstedt, a professor at BYU. The study was on what reduced your chances of dying the most. So I'm going to read you the list. Number 10, clean air. Number 9, treatment of hypertension. Number 8, being lean. Number 9, exercise. Number 7, exercise. Number 6, cardiac rehab. Number 5, getting a flu vaccine. Number 4, quitting drinking alcohol. Number 3, quitting smoking. But here's where it gets really interesting. The top 2 things that reduced your chances of dying. Number 2, close relationships. This really seems to support the results that the Harvard study of adult development also found. But the number 1 thing that this study found was social integration. How much you interact with people as you move throughout your day. Pinker said that one of the strongest influences on living a longer life were positive connections with others. It doesn't have to be a deep, forever love with a partner. It can be a simple, short conversation that you have with somebody at the grocery store or a compliment that you give somebody at the bus stop. It's the accumulation of small positive interactions that help us live longer. She goes on to discuss how social isolation is an indicator of poor health. So here I am, this little ball of anxiety, purposely isolating myself, not super active, and I've immersed myself in work. So here I am wondering if I'm going to live past 50. About 2 years ago, my spouse said, enough is enough. You need to get a handle on your anxiety. So this is what I did. I went to my healthcare provider, who, by the way, is a nurse practitioner, and I told her how I was feeling. And here's the key thing. She listened to me. We discussed coping mechanisms, activities, medications. She even sent me to a cardiologist because my anxiety was causing heart palpitations. I went to this cardiologist. She listened to me. She listened to my feelings, my symptoms, my story of anxiety. She told me her story, how difficult it was for her to work her way up into a profession that was mostly men. She could relate to my struggles on a certain level. Finally, she said, it's not your heart. You need to learn to say no to things that cause you stress and yes to better choices. She made me, right then and there in the office, write 10 things that I would do to decrease my anxiety. Over the years, I've implemented these 10 things. I started saying yes to going to the gym. I hired a personal trainer. I started saying yes to cooking my own meals, paying attention to my body. I started to turn off my brain when I left work. And the thing that I was avoiding the most, I started saying yes to asking for help from my spouse, my family, and my friends. I started having those hard conversations, about feelings and emotions and all those things. I started saying yes to attending parties and meeting up with people I cared about. I even started smiling at people in Costco. That still hasn't hit right, because people don't necessarily smile back. I slowly worked my way back to being me, felt like being me. I'm not gonna lie to y'all, I still have anxiety, but that too is something that I learned not to overstress about. That is what I am most proud of. Having the motivation to change things in my life to make myself healthier and happier. Last topic, number 3, success. What does success actually mean? What does it mean to be successful? Money, fame, degrees? What does it mean? I used to think that to consider myself a successful nurse, I had to want to do all the exciting things. I had to want to work in the emergency room or the ICU because that's what the TV and media told me. When friends and family asked where I worked and what units I worked on, it almost felt less important to say a medical floor or a nursing instructor. It took a while for me to figure out that they weren't judging me, I was judging me. I was measuring my success based on others around me. My measure of success wasn't critical care or saving patients through heroic measures, it was something else. It was all of you. My passion is teaching. Therefore, your success is my success. Your graduation is my reward. I've always told myself that I want my students to be better and do better than me. That might mean something different to each person, but to me, it simply means that I hope that each one of my students contributes to the nursing profession more than I have. One of my favorite things about teaching is hearing success stories. I love the email or the text messages that come from previous students telling me where they are, what they're doing, the new job they got. I love to hear the excitement and pride in voices. This is also a bit selfish, though, because it makes me feel good. It makes me feel good that I played a small role in the success of my students and the success of my profession. When I started teaching at NIC in 2015, I remember a student that I had in my very first class. She graduated from the practical nursing program. She went on to graduate at NIC with her associate's degree, got a registered nursing license, and as of last week, she now has a credential of doctor. She graduated with a doctor of nursing practice and was offered a job immediately. This is what success is for me. Her success is all I need to know that I'm in the right place in education. This school, this degree that you're getting today, it matters. It can be one way that you measure your success. But now is the time that you need to make a new goal, a new measure of success that fits you individually. Don't compare yourself to anyone else around you. It's all about making future you better. I told you the story about me for 2 reasons. 1, I wanted to show everyone that mental illness cannot always be seen on the outside. Sometimes people struggle internally, but are still able to function daily. This might be true about the person next to you, the family member behind you, or one of your future patients. So listen to them, like my providers listen to me. Second, I wanted to send a message that we're not alone and we shouldn't be alone. Humans are born with an innate capacity for forming social connections, and we should be making those connections both in our personal lives and with our patients. Your interactions with your patient could be the social interaction that they need that day to live a healthier, longer life. So now that you know how to live a happy life, a long life, and a successful life, I just want to welcome you into the profession of nursing, and I want to congratulate you on your personal success. So thank you for having me today.
Thank you, Brittany. Our students are really pretty amazing. We would like to take time to honor a few of them who have gone above and beyond what is expected. I'd like to invite Stephen Smith to the podium to present the Academic Achievement Award.
So I didn't plan this, but I'm just wondering, can I have Logan come up to help me present this award? Logan's the president of Honor Society, and I think it'd be appropriate if he was up here just helping give this award. Sorry, I didn't talk to him about it beforehand at all. Thanks, Logan. So this award is, the other awards are kind of voted on by faculty and students, or a combination of both. This one is just pure GPA, the student who got through this program and all their courses for their ADA degree. And this recipient will receive a plaque, and their name will be forever engraved on a large plaque in the nursing hallway. This person actually also happens to be an honor society and also serves as one of its officers. Oh, the president of honor society. Oh, it's actually Logan. Sorry. Logan, good job. Academic achievement. I didn't get the Academic Achievement Award. Next up, Megan. Please welcome Megan.
Okay, so I'm super nervous to be up here, and Logan's making me emotional. So this is way different than a lecture hall to be in here. But okay, each semester, a member of the graduating class is selected for the honor of the Spirit of Nursing Award. This recipient is recognized at pinning, and his or her name is engraved on a plaque, which is displayed in the Health Science Building. The nominees were selected by the graduating class and by the NIC faculty for excellence in the aspects of compassion, empathy, respect, integrity, professionalism, caring, critical thinking, and cultural competence, which was evident in all personal and professional behaviors and interactions. The nominees showed dedication, excellence, and passion for the profession of nursing. After much consideration, the list was narrowed down to one single student. Okay. Some of the words that were shared about this recipient are, okay. Okay, thank you, thanks, okay. You'll all agree with me when you hear them. And yeah, she radiates kindness and compassion. When you're around her, there is a calmness about her that makes you feel at ease. She will be an amazing nurse. She is kind and thoughtful and truly considers all aspects of those involved in her care. She is a woman of integrity and sincerity. She is genuine and a light to those around her. I'll leave you to guess who said this next one. When I have my first heart attack, hopefully she will be working in the ER that day. I would know I am in good hands if I look up and see she is my nurse. Her attitude, her work ethic, her kindness, her critical thinking, her smile, her attention to detail, her caring, all are outstanding. She really embodies the spirit of nursing. This award recognizes not only academic excellence, but also the embodiment of the true spirit of nursing. A spirit characterized by selflessness, empathy, and an unwavering dedication to the well-being of others. Okay. The nursing profession is fortunate to have this individual as one of its own. It is with great honor, with a U, that I get to present the Spring 2024 Spirit of Nursing Award to the wonderful Keza.
We got this. Each semester, the faculty selects a member of the graduating class for the honor of the Leadership Award. The recipient of this award is also recognized at pinning, and their name is also engraved on a large plaque displayed in the Health and Science Building. The nominated students have exemplified outstanding service and leadership to their fellow students in the community. They have shown a commitment to excellence and a willingness to inspire others. With much thought and consideration, one student was selected. And I want to be really clear that this class in particular has many leaders. And this was not an easy decision to come down to, because each one of you has stepped up in your own way to lead your classmates and be there for each other, which is not something we see in every class. So the chosen student for this semester has been a positive and encouraging example to fellow students and community members. This student has participated in class every semester, asking clarifying questions, contributing to classroom discussions, and engaging his or her peers in thoughtful discussions regarding course material. This student has served on committees as a voice for all students within the ADN program. This student has shown dedication, integrity, and professionalism in all aspects of their academic experience, and the student will undoubtedly continue to exemplify these leadership qualities as they continue into their career in nursing. The faculty proudly present the Spring 2024 Leadership Award to Erin Kohler.
And now, what we've all been waiting for. Some of you may be wondering what the significance of the pinning ceremony is. It's a time-honored tradition that dates back to the 1860s when Florence Nightingale presented a Medal of Excellence to her hardest-working nursing graduates. By 1916, it became standard in the U.S. to award all graduates with a pin during a special ceremony. The pin that each graduate is about to receive is a symbol of your commitment to excellence, your dedication to well-being of others, and your pledge to uphold the highest standards of care. This pin represents countless hours of study, sleepless nights spent mastering complex concepts, and the clinical experiences that have shaped you into the competent and compassionate individuals that you are today. Each nursing school has a unique pin that visually represents their school. The NIC pin is projected on the wall. The Florence Nightingale lamp, which she carried when tending the wounded during the Crimean War, represents comfort, goodwill, warmth, and steadfast devotion to duty in the darkest of nights of the hospitals. The hands represent the specialized skills you have learned and will practice throughout your nursing career. And the book represents the scientific knowledge that you've gained in nursing school. As lifelong learners, you will continue to build on this knowledge base throughout your career. This pin also comes with a commitment and responsibility to practice the skill and art of nursing to the best of your ability. Be advocates for your patients, be champions for health care equity, and be beacons of hope in the times of darkness. May the nursing pin you receive today serve as a constant reminder of your capacity to heal, comfort, and make a difference in the lives of those entrusted to your care. This ceremony is our opportunity to welcome you to the profession of nursing. We are honored to have been a part of your journey and proud to have you join us in this profession. It is especially appropriate that you're receiving your pin during the time we are celebrating Nurses Week around the world. Now is the moment that we've been waiting for, the presentation of the pins. I'd like to invite faculty to assist with the presentation. Sharon Funkheiser, Megan Netting, and Donnie Morrison, please come forward.
All right. Bailey Abner. Philly Atzpa. Melissa Beaver. Shane Blake. Jordan Bouquet. Faith Burt. Jennifer Casas. Deja Daniels. Lisa Ferguson. Joy Flory. Yuli Faust. Bailey Gillihan. Kiana Glidewell. Logan Haley. Callie Hansen. Lexi Haramis. Blythe Howard. Marfell Hunter. Dan Johnson. Maya Clary. Aaron Kohler. Hunter Kruger. Kayza Lagasse. Hannah Lee. Aaron McNee. Jess Parker Accardo. Levi Ponchek. Marissa Poquette. Maya Reed. Wade Roos. Zemene Roos. Lacey Spurlock. Sierra Sullivan. And Kristen Noel Wilson.
So one more round of applause for all of the nursing graduates. I'd like to invite Aaron Kohler and Cassia Legassi to the podium to lead us in the Florence Nightingale Pledge. Would all nurses please stand and join us?
I pledge myself here before my God and in the presence of this assembly to practice my profession with integrity. I will endeavor to maintain and elevate the standard of nursing, both as a science and as an art. I wholeheartedly recognize the importance of high standards of care and of personal accountability. I devote myself to the healing, protection, and welfare of those committed to my care. I accept a duty to work for the improvement of health in the communities in which I live and work. I will hold in confidence all personal matters committed to my keeping and will respect the privacy of medical information. I will act with compassion in ethical matters. I will not knowingly administer or consume any harmful substance. I commit to interdisciplinary collaboration
and lifelong learning. I fully acknowledge the seriousness of the responsibility that I accept in my calling and the significance of this pledge that I take today.
So go forth with courage, compassion, and the knowledge that you are now part of the profession that changes lives, one patient at a time. May your journey as nurses be as remarkable as the impact you're bound to make on the world. Congratulations to the class of May 2024. I would like to take a moment to thank you for being here to help us celebrate and share this special ceremony. After the ceremony, we ask that the audience please allow the faculty and students to exit first. Please meet the graduates in the foyer. Graduates, please return to the stage. Yeah. Okay, so spread out, guys. This is your picture. Oh, they got it. Oh, they have marks. Okay. Ladies and gentlemen, I present to you the Associate Degree Nursing Class of May 2024. Congratulations.
You know I'm back, like I never left. Another sprint, another step, another day, another breath. Been chasing dreams, but I never slept. I got a new attitude and a lease on life is a peace of mind. Seeking to find I can sleep when I die. Want a piece of the pie, got the keys to the ride. And I'm straight, I'm on my way. Get up my way. I'm running late. What can I say? I heard you died twice. Once when they bury you in the grave, and the second time is the last time that somebody mentions your name. So when I leave here on this earth, did I take more than I gave? Did I look out for the people, or did I do it all for fame? Legend is Exodus, searching for euphoria, judging through the mud to find the present, no ignoring us. Got 20,000 deep off in the street like we some warriors. that DeLorean